RSV stands for Respiratory Syncytial Virus, and it's a virus. It's similar in its symptoms to influenza in terms of causing fever, cough, and respiratory problems. It's predominantly a disease that manifests in children. In adults, it tends to be the symptoms of a common cold. And the problems with RSV come in with the very young and the very old, again, similar to influenza. And so it can cause severe breathing problems in young children, and in elderly it can cause the need for hospitalization for respiratory distress and need for oxygenation. And so we're seeing every year we have an influenza epidemic that occurs across the United States. It's been quite late this year, and we've really seen the bulk of the influenza infections in the Springfield region in the last 2 weeks. And concurrent with that has been a relatively late RSV season. When you look back historically, you see that RSV and influenza often peak together. They rise and fall together. And the same thing is happening, although RSV came on a little bit earlier this year than influenza, and as a consequence, we're seeing more cases this year of RSV. But I also want to point out that it's peak influenza season right now. It's not too late to get your influenza vaccination. That's the best way to prevent yourself from getting influenza. Both of them are highly contagious. There is no vaccination for RSV, so the way to avoid getting RSV is standard practices that we all do when somebody else has symptoms of a respiratory infection. Social distancing, wave instead of shaking hands, clean your hands often. Practice what we call respiratory etiquette, which is sneezing into a tissue or the sleeve of your shirt, and then cleaning your hands with either soap and water or an alcohol-based hand rub.